Hey guys, Tony Maritato here, licensed physical therapist, and today I want to introduce to you the OnlyCare. I've been looking for a recirculating cryotherapy machine, a cold therapy machine that I can recommend to my patients after a total knee replacement. A lot of health insurance plans will not reimburse or cover the cost of these devices, but they're incredibly convenient and easy to help manage pain in a drug-free way. So let me show you. OnlyCare was kind enough to send me this sample pack so that I can see what the device is like, how it works. In the package, you get the waterproof cooler. This is where you're going to put frozen water bottles or ice into this. Most people will use 2 or 3 frozen water bottles and then fill the rest of it with water. This is the recirculating pump. Now what's nice about this is this pump is super lightweight, easy to use, but it's incredibly quiet. So if you want to use this in bed, if your spouse is sleeping next to you and you don't want to wake them up because of the constant humming of the pump, this is one of the greatest options. And simply all you do is you put the pump into the water, the power supply will plug in about midway down the hose. This will plug into a typical wall outlet. You would close the lid, you would bring the zippers around just to secure it so that the hose stays in place and the pump stays submerged in the ice cold water. And then of course, you have the applicator on the knee. These are elastic Velcro straps. When you're using this, the hose will be oriented down. The kneecap will be right in the middle of this cutout area. You're gonna wrap one strap around, wrap the other strap around, and now we're ready to sit back, relax, and enjoy the cold sensation to reduce pain, reduce swelling, manage inflammation, and allow you to facilitate healing. A couple of the things that I want to mention here: the handheld controller. You hold the button down, the timer will come on. I can set the duration. Usually what we would do is we would recommend elevating the leg for 2 reasons. One is elevation is going to help reduce swelling. 2, elevation without support under the knee is going to allow the knee to sit into a little more extension. After a knee surgery like a total knee replacement, one of the main things we want to do is we want to try to get the knee straight. This is a great way to do it. Typically, we would recommend icing the knee for 10 to 20 minutes. If you want to go longer, you can take a break. Probably the thing I love most about this OnlyCare system is that when I am finished, once I drain the water, once I dry out the inside of the cooler, I can take everything apart. I can open it back up, and everything stores inside the cooler itself. So it's a fully self-contained system. This just wraps around itself. This will come in here. The handheld controller will store. We close the zipper, and now we're ready to go. This can sit in the closet, this can go in the bathroom, you can put it wherever you need it. It's lightweight, it's portable, and it's incredibly affordable. So if you've been looking for a solution to cool the knee, ice the knee after knee surgery, or just if you've been dealing with osteoarthritis and the knee gets swollen after you've been walking or jogging or working out, the OnlyCare system is a great option for you. Go ahead and check it out.